Symptoms of a rare inflammatory condition have been identified in at least 15 children in New York City hospitals, alarming pediatricians across the country and raising concerns about a possible link to the coronavirus. The patients exhibited symptoms typically seen in Kawasaki disease or toxic shock syndrome, including a persistent fever, according to the city's health department. The children were between 2 and 15 years old and were identified between April 29 and May 3. While all the patients had a fever, more than half of them reported a rash, abdominal pain, vomiting or diarrhea. In an alert issued to doctors, the NYC Health Department said less than half of the patients exhibited respiratory symptoms. 4 of the cases tested positive for COVID-19, while 11 tested negative. No deaths have been reported, but many of the patients required blood pressure support and 5 of them required mechanical ventilation, the city's health department said. Both Kawasaki disease and COVID-19 are elusive conditions that doctors are still studying. Some experts doubt there's a link between the two, while others don't believe the mysterious symptoms belong to Kawasaki at all. What is Kawasaki disease? Kawasaki disease is one of the great mysteries in pediatrics, said Dr. Frank Esper, a physician at the Cleveland Clinic's Center for Pediatric Infectious Diseases. It's something we've been dealing with for decades. Symptoms include a fever of at least 101 degrees that lasts for 5 days or more, a rash and swollen glands in the neck, according to Britain's National Health Service. Esper says that it predominantly affects children between the ages of 2 and 6, tends to run during mini-epidemics, and is more likely to happen in the winter than the summer. While doctors know how to treat Kawasaki disease, they still don't know what causes it or why some people get it. Esper says a cemetery of different reports have hypothesized the disease is caused by viruses, while others say people may be genetically predisposed. Is Kawasaki disease related to the coronavirus? Experts say it's too early to tell if the disease can be associated with COVID-19. We've never seen the coronavirus before, but we've been dealing with Kawasaki disease for decades, Esper said. He also said that experts aren't even sure if the mystery disease popping up in parts of Europe and the US can be definitively identified as Kawasaki disease. So far, he hasn't seen any of the reports mention coronary artery dilation, which would be a major indication. I will caution that there are many things that look similar to Kawasaki disease, Esper said. It could be that what they're calling Kawasaki is not Kawasaki but an inflammatory disease caused by the coronavirus. If you want to receive more updates and news trends, please don't forget to send us a like and subscribe. Thank you.